Welcome to Ararat Healthcare and Charcos Learning Centre, your one-stop solution for IELTS, OET, CBT and OSCE training, as well as recruitment to achieve your dream to be a registered nurse in the UK. To enhance your chances of passing your OSCE on the first attempt, please visit our website on www.charcoslearningcentre.com to register and book our unique OSCE portal consisting of videos, reading material and quizzes. This registration not only gives you access to the portal, you will also receive 5 complimentary online classroom-style sessions and a mock OSCE test. So don't delay, you're achieving your dreams any longer and sign up now.
Hi everyone, my name is Dr. Seema Balyan. I'm the Director of Allergic Healthcare and Charcos Learning Centre. Welcome to my lecture series on NMC OSCE. Now in this series, I will be covering up the topics related to assessment, planning, implementation, evaluation, some of the new scenarios which have been added such as the NG tube, pressure ulcer assessment, and VIP and the intravenous flush, and also we are going to take you through the fluid balance. The aim of this series is to understand in depth that the logic behind all of the things, why we are doing, how are we doing these things, what precautions we have to take while we are doing assessment and the rest of the stations, and also the top tips. So I hope that you are going to gain out of it as much as I'm trying to put in my efforts. There are 7 episodes to this series which are going to be covering up various topics. Please do let me know if there is anything that you would like us to discuss about in future as well. And it would be great if you can subscribe on our channel and press the bell icon to get the regular updates. So I hope you will enjoy it, and thank you very much again for watching this series.
So Shiny, can you take me through the introductory 6? So consider you as a patient. So you can take yourself as a patient, and you can just show your own details, and you are coming to do an assessment. So the history, I'll give you a very brief history. So the history is that the person has been, or the patient has been admitted with shortness of breath and has been diagnosed with asthma. And now the doctor wants this patient to be started on some inhalers. Okay, so this is your scenario. And you have to do the introductory 6 and till the point where you are establishing what is the purpose of your visit.
I start, ma'am?
Yes, you can.
As soon as I enter the room, I will see that the scene is safe to enter. Okay, the scene is safe. So I will enter the room. First of all, I will wash my hands. Take the hand rest, palm to palm.
Go up a little bit. Yeah.
Okay.
Yeah. So palm to palm.
Palm to palm, back to back. Then interlock. Then I have to interlock
yeah.
Then this one.
Mm-hmm.
And the wrist.
Okay, good.
Then I'm safe to approach the patient. So once I'm near to the patient, I will introduce myself. Hi, good morning. I'm Shiny. I'm here to assist you today. Can you please tell me your name, please?
Okay, my name is Seema Balyan.
Okay, thank you. Then can I check your ID card, please?
Yes, you can.
Okay. So your full name is Seema Balyan. And can you please tell me your date of birth?
So it is 1st of January in 1984.
1st of January 1984. That seems correct. And can I read your hospital ID, please? It's 10203A.
Okay.
Okay. It says correct. And can I just ask you, do you have any allergies, please?
Yes, I'm allergic to penicillin.
Okay, fine. I can see that there is a wristband which says that there is additional wristband which has allergy indicated on it. Can I check it?
Yes, you can.
Okay. Your full name is written, Seema Balian, and the allergic drug which says it's a penicillin. So, is that correct?
Yeah.
Okay. Can you please tell me what happens if you are taking penicillin?
I get an anaphylactic reaction.
Okay, fine. That means you will have redness, or what are the signs or symptoms you will have?
So my throat swells up and my lips, and I find difficult to breathe.
Okay, fine. I can assure you that I will not administer this medication, and it is already documented in your wristband, as well as it's there in your patient file. So don't worry about that. So can you please explain to me what brought you today here?
I was having shortness of breath.
Okay, fine. So today, so I will just assess your condition. So I will go ahead with your temperature, blood pressure, respiratory rate, and oxygen saturation. So, have you taken adequate rest 20 minutes before?
Yes, now I'm feeling better.
Okay, fine. That's good. And have you emptied your bladder?
Yes.
Okay, fine. Are you feeling comfortable?
Yes, I am.
Okay, can I go ahead with the assessment?
Yes, you can.
Okay, thank you so much for that. Then I will prepare myself. I will arrange things which is needed for the assessment. I will clean the equipment, calibrate it, and bring it to the patient. Then explain to them that I will go ahead with the assessment. So, okay, Seema, can I go ahead with assessment?
Yes, you can.
First of all, I will start with the temperature. So before doing temperature, if it's what's that thermometer, according to the thermometer we need to assess. Yeah, then
tympanic thermometer.
tympanic one. So I will just ask the patient whether they have any sort of hearing aids they are wearing. I will confirm it before going ahead. Are you wearing any hearing aids?
No, I'm not wearing any hearing aids.
No, and externally I will assess for any redness or swelling or any other issues related to ear. So I cannot see anything obviously. So I will go ahead with the temperature. So I will pop this thermometer into your ears. Is that all right for you?
Yeah, that's fine.
Okay, I will check the temperature for a second. Okay, it is within the normal, 36.9. So can I go ahead with the blood pressure?
Yes, you can.
Do you have any cannulas on this hand? I cannot see anything.
No, there is no cannula.
Do you have any prior surgeries?
No.
No, then it's all right. So can I go ahead with the blood pressure monitoring on this hand?
You can.
Okay, then I will measure the blood pressure. Okay, it's fine. Then I will, without telling the patient, I will just take my stopwatch and count the respiratory rate for the rhythm and the pattern for complete 1 minute.
Okay.
Okay.
It is over.
1 minute passed and it's around 20. I have assessed your respiratory rate. It is 20. I will document it later. Can I go ahead with the saturation?
Okay.
Okay. Okay, there is no nail polish. The capillary refill is fine. So, is there any artificial or false nail which you have added? No. Then can I proceed with this saturation?
Yes.
Okay, fine. The saturation is within normal. So, okay, Dr. Seema, I have completed the assessment. And now, how are you feeling?
Yeah, I'm feeling all right.
Okay, do you have any pain?
No, I don't have any pain.
Okay, fine. That's all right. So I will just go ahead and document all the things. Okay. I will give you this buzzer in case if you need any assistance, I can come and assist you. I'll be around here. Okay. Now I will do the documentation. I will be around. Okay. Again, I will do the hand washing, hand rub technique. Okay. Then I will make the patient comfortable. In case of additional needs, I will find out. In case of changing and everything. I will make them to be more comfortable.
Mm-hmm.
Do the hand washing, go back and document all the things which I have done.
Well done. It was really good. And for the first attempt, it was excellent. I did not stop you because I wanted to see if you can just carry on and complete it. So it was really good. So well done. I'm really impressed with this one.
Thank you.
So I think this forms a good base of our discussion today. So I think that once, let me just bring up my screen and we will go through the little presentation. And there will be few things which I will be, when going through the presentation, we will go through it, that what you could have done better, or what are the things which you could have added to this as well to make it like a complete assessment. Yeah, but for your first attempt, it was excellent. Now, who are you with? Like, who is your roommate? Or are you alone?
Nobody, because I am from Qatar, so I am alone in this.
Okay, so you are alone. Okay, that's fine. That's not an issue at all. Okay, so I'm just going to share my screen. Now, can you see my screen?
Yes, ma'am. Yes,
Okay.
ma'am.
Yes, ma'am.
Good. So how did everyone feel what Shiny did? Did everyone think the same? Like, was she very impressive? Did she do really good?
Yes, sure, ma'am.
Yes, sure. Yeah, sure, Srila.
Okay. So see, it is not difficult at all. It is just a matter of like that you have to just practice it in the correct manner. Yeah. So I'll run through the first few slides very quickly because they are almost the repetition of what we had already discussed yesterday. Okay. So we all know about this one. So that is, I had told you about the OSCE as well, that what it is, why we are doing the OSCE. It is basically, it is designed to see your knowledge at the base level. So when you are entering into the point of registration, so they are not checking actually an advanced information or advanced experience. They are just checking at the level of entry point for your registration. Yeah. So it is basically your level should be the same as that of a newly registered nurse. Okay. And hence we are going to go through all these basic things that as a nurse, you should, when you qualify, that you should know all these things. Okay. So again, it is the OSCE exam is testing your ability to apply your knowledge. So when you have done your nursing degree, at that time you have learned so many things. So, but all the things that you have learned, you should be able to apply those things in your day-to-day life and care when you are caring for the patients. So that is basically what this exam is checking, that whether your theoretical knowledge, whether you are able to apply it in the practical sort of thing. Yeah. So all of the scenarios that you will be getting and the criteria against which you will be marked, they are all as up to date with the current best practices. So that is what they are going to be checking you against. Okay. So we had yesterday as well, we had discussed that communication is the key to everything. So even if sometime, even if you are not able to demonstrate something, but if you are able to communicate that, or if you are by your communication, if you are able to show that you are a skilled person or you are a compassionate, caring nurse, that is going to be being so helpful rather than you showing something or doing something without a good communication. So communication is the key everywhere. So it has to be clear. You have to make sure that you look at the patient, you are explaining to the patient, you are using the layman terms so that the patient can understand it. You are caring, you are observant that of whatever the patient's verbal and non-verbal communication is there. And you take care of all of your observations that you have taken, and appropriately then you can decide that what should be the next action, and then explain the action to the patient, giving the patient enough information so that if they have to make some decision, they can make that decision, and also that they are able to understand is so much that they are able to raise an alarm if required, and they know what is normal, what to expect, and they are as relaxed as possible about their condition. So I think that this, the main aim for the communication should be this, that you should be able to communicate and make sure that your patient understands everything, you understand the patient condition, and together you are able to win over whatever condition the patient is in. Yeah. So again, even this slide, we had already sort of the sequence I had already told you that API is always together. So you will start with assessment, and then whatever assessment you have done, you are going to write the care plan according to that assessment. The same sort of assessment that you did, the same patient's implementation or the medication you are going to do, and the same patient's evaluation you are going to do. Okay, so it is going to be taking you through the same journey. Now we will try I'll try my level best that we take one patient and we try that when we are doing the care planning, that we pick up the care planning of the same patient and implementation of the same patient and evaluation of the same patient. So at least you are able to see the journey of one patient. Now today I have, I wanted to give you examples of at least one assessment in each of the sections. So one news assessment, one GCS assessment, one PHQ-9, and one must assessment, so that you are able to understand all four of them. So we'll try and see if we are able to complete all of them. There will be quite a few things which are going to be repetitive in them. So if it is becoming repetitive, those things we might skip by saying that, okay, it is same as what you did in news, and the rest of the thing, I should be able to explain them to you. Okay. So I think this slide as well, or the information in this slide as well, we had discussed yesterday that there are two hospital-based scenario and there are two community-based scenario. News, you know, is a hospital-based scenario. GCS is also a hospital-based scenario. And in the community, you have a must and your PHQ-9. So in the must and the PHQ-9, you will also be required to, along with the completing the must and the PHQ-9, discussing the findings of the must and PHQ-9, you will also need to fill up a TPR chart. Now today I have shared all the charts with you guys. Yeah, so if you will see the charts, then I have shared the news chart, the GCS chart, the TPR chart, and the must chart. Now, I know that all of you are in the quarantine, and or at least some of you are in the quarantine, but the people who are not in quarantine, and if you are able to get a printout of these charts, it will be great. Because then what you can do is that we can I can share some flashcards on the group, and you all can practice filling these charts, because it is very, very important that you practice completing these charts on a regular basis. Yeah. And the people who are in the quarantine, and if you're not going to be able to obviously get a printout, then at least you can see those charts. And in your copy, you can just try and fill around the same and try and calculate the news score and see that you are able to do them correctly. Okay. So any questions so far? No? Okay. This we have already discussed, the introductory 6. So Shiny, excellently, she did all of those things. Now, if I were to sort of say a few things in this one, now remember that you did absolutely fine, that you went in, you checked that the room is safe for you to enter. When you are saying the room is safe for you to enter, I think it might be a good idea that you can mention that as well, that I can see that there is no loose wires, there is no spilled water. There is no trip hazard which is there. So it is safe for me to enter the room. So by doing this, you are actually making it very clear to the examiner that I know that what safety I'm looking for. Yeah, so you could say that. Then once you have done the safe, then you are going to say that, yes, I'm going to do my hand hygiene before I approach the patient, which you did, and it was absolutely fine. So hand hygiene, I want all of you to keep on practicing so that you get in a habit of all those steps, and you are able to do it very quickly. Okay, so it is palm to palm, back of the hands. Then it is fingers interlacing, fingers interlocking, rotation rubbing of the thumb, fingertips, and your wrist. Okay, so all of you, please practice it so that there is no confusion in that and that you are always able to do it very quickly. Okay, so then you introduce yourself, which was again excellent way of introducing that this is who I am, this is what I work as over here. So you can say that I am Shiny, I'm one of the registered nurse over here who will be looking after you today. Yeah, which you did fine. Then you confirmed the patient identity. Again, that was very good that you checked what is the patient's name. You checked with your notes that what the patient's name is, and you checked for the date of birth, the hospital number, because this patient is in the hospital. So you are going to be checking the hospital number. And then you checked with the wristband as well. So when we are confirming the patient ID, there is something called as a three-way ID check. Okay. Now, what we mean by three-way ID check is that we are checking the patient's identity in 3 ways. Now, the 3 ways, if we are in the hospital, the 3 ways become that you are going to ask the patient. So the patient is verbalizing. Yeah. So I'm telling my name. So that means that I'm verbalizing. So that is one way of doing that. Second way is that when the patient is verbalizing, you are checking it with your notes that you are having. So that becomes your second way that you have checked with the patient's verbalizing as well as the notes that you are having. And the third way is that you are checking with the patient's ID band. Yeah, so the ID band becomes your third way of checking the patient's identity. So these are the 3 ways of ID check. So I think that,
Excuse me, ma'am.
yeah.
Ma'am, we can't see the screen.
Okay, I'll try and bring it up again. Was no one able to see the screen or only you guys?
Me too.
Can you see now?
Yes, yes.
Yeah, I can see, but Anshu can't.
Okay, now it's
Yeah, now it's fine, ma'am.
Okay, that's
Thank
fine.
you, ma'am.
Thank you.
Yeah, no issues. Yeah. So again, going through that, coming back to the 3-way ID check. So it might be a good idea that whenever you are telling the examiner or whenever you are doing this ID check, say in the end that, okay, I have done my 3-way ID check and I can say that I'm with the correct patient. So in that way, you are taking off that confusion or that thing ambiguity from the examiner's mind that whether you know the 3-way ID check or not. So you have told the examiner that I have done my 3-way ID check and I know that this is the correct patient that I have. Yeah. In the community scenario, because the patient will not have a wristband. Yeah, because when they go to their home, the wristband is taken off, so they won't have a wristband. So in the community scenario, your third ID check will become either the patient's picture. Sometime there is on the discharge letter, you will get a patient's picture. So you can use that, or you can ask the patient about that who is their GP. Yeah, or which GP surgery are they registered with. So if the patient is able to tell that also you can check it with that one, that becomes like a third ID check for that patient. Has everyone got that?
Yes, ma'am.
Yeah, so this
Yes,
is
ma'am.
so these are the 3 way of ID check that we are going to do. So get in a habit of saying these things so that you know that you have confirmed that it is the patient you have done the 3-way ID check of the patient. Then we come to the next one of establishing whether the patient is allergic to anything. Yeah, which you did absolutely well. So you ask the patient that are you allergic to anything? And the patient had said that I'm allergic to penicillin. Now, when you are asking about allergies, we are not just bothered about the medication allergies. Because see, in the hospital, it is possible that you will use a plaster, you will use the adhesives, you are going to be using gloves, which will be of latex. So it is possible that the patient is allergic to any of these things. Yeah, so when you are checking for the allergies, make sure that you ask that whether you are allergic to any medication, adhesives, plasters, or latex. Yeah, or any food allergies if they have. Yeah, so let the patient then tell that whether they are allergic to anything. Yeah, so once they have said that yes, I'm allergic to penicillin, and you rightly so in UK what they do is that if the patient is allergic to something, they will wear a red wristband. So the wristband are of red color and white color. So if the patient is wearing a red wristband, that indicates that patient is allergic to something. Yeah, and that allergy is written on the wristband as well. So as you rightly said that I can see that you are wearing a wristband, an extra wristband. So you said that patient is wearing an extra wristband, but usually it is the red colored wristband that the patient will be wearing. So you can say that, yes, I can see that you are wearing a red wristband, which says that you are allergic to penicillin. Also, it is well documented in your notes. So we will make sure that you are not going to get any penicillin or penicillin containing medication. Yeah. So you have established that the patient is allergic and that everyone knows about that allergy, and that you have reassured the patient that they are not going to get any penicillin containing things. Yeah, so if the patient is wearing a white wristband, you can also say that, okay, I can see that, yes, you are wearing white wristband. So rather than then saying that, okay, then that means that you are not allergic to anything, ask that, I can see that you are wearing a white wristband. Are you allergic to something? Let the patient confirm it, that no, I'm not allergic to anything. And then you say that, yeah, okay, that is fine. And hence you are wearing a white wristband, so which is fine. And your notes also say that you are not allergic to anything. Okay, has everyone understood this thing?
Yes, ma'am.
Okay.
Yes, ma'am.
Yes, ma'am.
So once you have done that, then you go to explaining your purpose of the visit and gaining consent, which again, Shiny did in an absolutely brilliant manner. So she said that, yes, I can see that, rather it was actually quite good that when you ask the patient that, okay, so what brings you over here? So that you are letting the patient tell that what happened. Yeah. So that is a very good way of saying that. Or you could just say that, okay, I have gone through your notes and I see that you were brought in with shortness of breath. And now the doctor wants me to just go through and do an assessment. Yeah. And as you said, the assessment is going to include taking your blood pressure, temperature, pulse, and those things. Is it a convenient time for you? Do you want to go to the toilet before, or do you want to have a cup of water or drink or something? And very good that you ask the patient that whether the patient has rested for the for 20 minutes, because it is important, especially if you are going to do the blood pressure, that the patient have been calm and quiet so that you get the correct reading of the blood pressure. Yeah, so it was very good in that way that you checked all those things. So I'm really happy that you were able to, that you had taken into account what we discussed yesterday, and you were able to show me all of the introductory 6. So well done for that one. Yeah. Now, has anyone have any confusion in the introductory 6? Yeah, is it clear to everyone? So all of you are going to keep on practicing the introductory 6, because see, remember, introductory 6 are the things which you are going to do for each and every station. Yeah. And you will be doing this as the first part when you are entering. So if you are able to do this correctly, that is going to give you so much more confidence, because you enter and you do everything right. So, and when you keep on doing things right, it is going to improve your confidence, and you will be able to do the skills or your rest of your station in a very good manner. So it is very important that you nail the introductory 6. Okay. Are you still able to see my screen?
Yes, ma'am.
Yes, ma'am.
Okay, so now moving on to the next one. So when we are doing the assessment, as we had already said, that in the assessment, you are going to be checking blood pressure, temperature, oxygen saturation, pulse, respiratory rate. Now, in this one, when we are doing the blood pressure, so can someone tell me, or maybe Harsha, can you tell me that when you are doing a blood pressure, what all are the things that you need to check when you are taking a blood pressure from someone?
Whether the patient rests for last 20 minutes,
Okay.
then we need to check, select a correct cuff size.
Okay.
Then
What
we
is
need
a correct
to-
cuff size? How would you say that this is a correct cuff size?
That is, it should cover It should
Cover how much?
2/3 of our upper arm.
Okay, anyone can anyone tell me the percentage of that how much percentage it should cover of the arm circumference?
80% of
80%. Well done, Nivya. So it should cover 80% of your arm circumference. So okay, that's great. So carry on, Harsha. So
Then we should wrap the cuff
yeah,
2 to 3 centimeter above the antecubital fossa.
great. Yeah.
Then
Before you wrap the cuff, is there something else that you will be checking? Anyone? Anyone else want to tell me? Anju?
Yes, ma'am. First, we have to check whether any cannulas on the hand. We are going to check the blood pressure, and also any surgeries done for the patient on that hand, and also for any inflammation, redness, or any lumps like that. We have to check all that. Then after that, we go ahead with the checking of blood pressure.
Excellent. So before we just go ahead, we need to make sure that if we are going to put a cuff on someone's arm, we need to make sure that there is no bruising, redness, swelling, there is no pain in that arm, the patient is not having the cannula in that arm, there hasn't been any recent surgery, there is no wound or all those things. And then we are going to be putting the cuff. Now, one thing which I know why it happens, but something that you all need to be aware of is that make sure that you are saying that you are going to tie the cuff in the upper arm. Okay, don't use the word hand. See, this is hand. This is arm. Okay, so it is a very common mistake that all of us we make, because I can understand that, because I think that when we convert from our language, when we transfer it into, or when we translate it into English, it just becomes hand. Yeah, because in our language we use this way. Yeah, so please be aware that this sometime, because it is possible that now you are going to get an actor. So the actor, when you say that, okay, let me tie the cuff on your hand, they will just forward you the hand that, okay, tie the cuff. That is not where you want to tie the cuff. It is the arm that you are going to. Okay. So you will be checking before you are going to be doing putting the blood pressure cuff. You are going to be checking all these things, that there is nothing wrong in that arm, and it should be safe for you to apply the cuff. Okay, that's good. So Harsha, carry on. So then what, you have tied the cuff, then what are you going to do?
Then we can inflate the cuff, or whether it is we have to check whether it is a automatic machine, or
it will be an automatic machine. So when you are going to, when you are going to inflate the cuff, what is going to happen to the patient? Lakshmi, what is going to happen to the patient?
If it's the first time, the patient may feel uneasy. So we have to tell them that when we inflate the cuff, it will become more tight. So nothing to worry about that. It will deflate after a few minutes. So the patient will be okay.
Yes, excellent. So this is what you will need to tell the patient, that you will need to warn the patient beforehand that what is going to happen. Yeah, if I'm getting my blood pressure done for the first time, and if any one of you would have got the blood pressure done, you'll feel that at one stage before the blood pressure cuff starts to fall down, your arm is really squeezed. Yeah, and you really feel your hands go very tingly and all that sort of thing. Yeah, so you don't want the patient to get very anxious and scared that what is happening. Yeah, so you want to pre-warn the patient that, okay, when I'm going to start, it is going to squeeze your upper arm, which is normal. Yeah, but it is only going to last for a couple of seconds, and then it will then the pressure will go away. Yeah, So, and you will also need to tell the patient that if you feel that it is painful or something, then just let me know and I'll stop it. Okay. So it is very important that before you are carrying out any kind of procedure, that you warn the patient doing the procedure, that what is exactly going to happen, so that the patient can expect that this is how it is going to be, and they are not unnecessarily worried. Okay, so that's good. So now we have told the patient that it is going to be squeezing your arm. Then what are you going to do, Harsha?
Then we have to see the values and inform the patient whether it is in normal range, and make them feel comfortable. And we have to record it immediately after we get the results.
Okay,
Then
so
remove the cuff and make the patient comfortable back into a normal position.
Excellent. So this is what we are going to do after that. So now everyone knows that when you are going to take the blood pressure, what we are going to do. So we will check that the blood pressure cuff that we have taken, it is clean and it has been calibrated. So all of the instrument, we need to make sure that they are clean and calibrated. Yeah. Then we are going to say that I have chosen the right size cuff for you. So it is going to cover at least 80% of your arm circumference. Then you choose that which side the patient would prefer. You can ask the patient that which side would they prefer. Once they have given the choice that, okay, go, either they'll say that, okay, go on right or left, or they might say that, okay, whichever, I don't mind. Then you can choose which side you are going to go. So go on that side. Before you will tell the patient that, okay, before I put the blood pressure cuff, can I just check that whether you are having any aches or pain in that arm, or whether you have had any recent surgeries or cannula or something. So you can check with the patient. Let the patient say that, no, I'm fine, there is nothing else wrong. So you are going to say that, okay, that is fine. So now I want you to just pull up your sleeves. Ask them to pull up their sleeves. Also very important, ask them to uncross their legs. Okay, so ask them to uncross their legs, pull up the sleeves, try and be relaxed. Yeah, and then you are going to say that, okay, now I'm going to tie it about 2 to 3 centimeters above the antecubital fossa. So then you tie the cuff and tell the patient that I'm going to start the machine. So it is going to, you will feel that your arm is going to be squeezed. Yeah, but don't worry, that is not going to last for very long. But this is how the blood pressure is taken, and it should not be painful. It is going to be uncomfortable, but it should not be painful. But you let me know if it is painful, then I'll stop it. Okay, so once you have done that, then you say that, okay, now you put the blood pressure cuff on, and then you turn on the machine. When you turn on the machine, it is going to be recording the blood pressure, and you will get a display on the blood pressure machine that what is the blood pressure of the patient. Now, till now, what was happening was that we were just verbalizing all these things because there was a mannequin. In mannequin, you are not going to be able to do it. But now for your batch, it is going to be a person or an actor. So you are going to get an actual reading. Okay, so when you get an actual reading, you have to make note of that reading, and you make sure that you say it aloud that, okay, your blood pressure is 120/84, and you make the note of that correct reading. Now the examiners are going to tell you not to turn off the blood pressure machine. Yeah, do not turn off the blood pressure machine, so that they are able to see that what was the recording and what you have recorded in your news chart. Now, either you can do it, record it directly on your news chart, you can plot it, or you can write it on a paper and then all of the readings, and then you can transfer it onto your news chart. So that will be a choice that you will have. Okay. So when the other thing that we normally would do is that when we are doing, when this blood pressure is happening, so you have started the machine, it is going to take around a minute or so for the blood pressure to come. So in that time, to utilize your time better and to make sure that you give yourself enough time, what you can do is that you can check in the other hand, you can check the patient's oxygen saturation. Okay, Now, Agu, do you want to tell me that how are you going to check the oxygen saturation? You need to unmute yourself.
Before checking that, we need to check whether they have any nail polish.
Okay, who is telling me? Is it?
Titi.
Huh? Sorry,
Titi, ma'am, Titi.
Titi. Okay, Titi, just carry on. So tell me, what are you going to be checking?
So first of all, we need to check they will wear any kind of nail polish.
Okay. Yes.
And also any swelling in the area, nail area.
Is it the two of you
Redness.
there in the room? Are both of you having your laptop or phones on?
Yes,
yeah, one of you need to then mute the other. Yeah. Okay, yeah. So you have checked that there is no nail polish. Then
any swelling or redness in the nail area, like a finger.
Okay.
Where we are planning to check. So,
okay.
And
then,
whether their hand is scald.
Yes.
To make sure before we are checking.
Yeah. And
any extension or like any rings or anything they they used, means we need to make sure that. And if they wear any kind of rings, means we just make sure that we are trying to go back, so bring the rings to their family members.
Will the rings have any effect on your oxygen saturation?
No. If like the patient is or scheduled for any kind of surgery, anything, means we just want to make sure.
Let's not go over there. We are just at the moment confined to just checking the oxygen saturation. So we know that we will need to check that whether the patient's fingers are not cold and clammy, because we know if the fingers are cold and clammy, then that can constrict your capillaries, and hence your capillary refill is going to be less. Okay, so we need to make sure that the hands are nice and warm, they are at the room temperature, so they are not cold and clammy. So that is good. We also want to check that the patient is not wearing false nail or nail varnish. Now, why do we check that one? False nail or nail varnish. Why do we want to check that one?
So there are chances to get some kind of false rates. So
Sachin, tell me that how do you check a capillary refill?
Okay, so in order to check a capillary refill, we have to apply some pressure on the fingernails and hold it for up to 1 second, and then release it, and we can see that the nails at the time of applying pressure, the nails will turn white, and after releasing, it will slowly gain the red color.
Okay, so as you can see now, Titi, that if the patient is wearing nail varnish or if they are wearing false nail, then you will not be able to see that pink color returning back. Yeah. So that is important, that why we need to make sure that the patient is not wearing a nail varnish or they are not having a false nail. Now, when we are checking the capillary refill, it's good, Sachin, that you told me the correct process. So when we are pressing the nail bed, we normally press it for around 5 seconds against a hard surface. Okay. So let it really go white. And then when we leave it, the color should return below 2 seconds, in under 2 seconds, for us to say that it is a normal capillary refill. Everyone got that? Yeah?
Yes,
you will press it against a hard surface for around 5 seconds, leave it, and within 2 seconds, the color should come back for us to say it is a normal capillary refill. Okay, so once we have checked that the capillary refill is normal, then we are going to be attaching the oxygen saturation probe to that finger. Okay, So when you attach the oxygen saturation probe, then you can say that, okay, I can see that the blood pressure is, I have got the blood pressure reading, so it has been taken. By the time you will do this, the blood pressure would have been taken, and you take off the blood pressure cuff from the patient. Yeah, you note down your reading, do not turn it off, do not turn off the machine, and you are going to take the cuff off from the patient. By the time you will take the cuff off and think, your capillary or your oxygen saturations will also be recorded. So you can record your oxygen saturation as well. Yeah. So in this way, you are able to utilize that time and you are able to take your two readings. So blood pressure you have got the oxygen saturations. Yeah. After that, it is that I would suggest that after that you do the temperature of the patient. Now, so who is going to tell me about the temperature? Angel, do you want to tell me how are you going to take the temperature of the patient? Unmute yourself, Angel.
Hi, ma'am.
Hello. Yeah.
Okay. First of all, before taking temperature, we need to tell them to I'm going to take the temperature now. So
yeah.
If it is a digital thermometer, we can take the temperature by sensing it on the forehead.
So it is going to be a tympanic thermometer that you are going to get. If you can see in the picture, that is the tympanic thermometer that you can see. Has anyone used tympanic thermometer? Angel, have you used tympanic thermometer?
No, ma'am. I didn't use.
Okay, so basically tympanic thermometer is a thermometer which checks your your temperature inside your ear.
Okay.
Okay, so where is tympanic membrane?
It's in the ear canal.
Yeah, so your eardrum that you say, that is actually your tympanic membrane. Yeah, so that as the name suggests, tympanic thermometer, that it is going to check the temperature from the tympanic membrane. Because now tympanic membrane is inside your ear, you are more likely to get a more accurate blood temperature when you are checking it from that. Okay. So now in this one, what happens is that you are going to be, if you will see in the picture, so you see that there is this little probe towards the end of the picture. Can you see that?
Yeah, yes, ma'am.
Yeah. So that little, on that probe, you are going to be putting a cap. This inside the box, if you will see inside the box, there is another box with a lid open. Can you see that one?
Yeah.
Yeah. So if I increase, can you see it a bit better now?
Yeah. Yes, ma'am.
Yeah. So that contains all the probes, or that contains the cap of which go on this little probe over here. So you are going to put a new cap for every patient. Okay. So when you are obviously going to come for the face-to-face training, then we will be able to show you how to put a new cap. So you will be putting a cap on, and then when you will turn it on, you are going and you put inside the patient's ear, you will be able to see that there is a you will be able to see that why did the lines come? Anyway, you will be able to see that there is a beep sound that you will hear when you are going to take the temperature. And the beep sound will mean that the temperature has now been recorded. Yeah? Has everyone understood that?
Yes, ma'am.
Yes.
So before you take this temperature, as Shiny had earlier said, that you are going to check with the patient. Now, because this is something that you are going to be inserting into the patient's ears, you need to first make sure that the patient is not wearing any hearing aids. Yeah. Also, you will need to make sure that the patient is not already having some pain in her ears. You will also need to make sure that there is no discharge or something which is coming out of the ear. Yeah. So you are going to check all these things before you take the temperature. And once you know that, okay, nothing, that patient is not wearing hearing aids, they're not having any pain in their ears, the ear canal is not flooded with any discharge, then you are going to insert it, take the temperature, and you are going to discard the cap into the clinical waste. Did you understand that? Everyone got that? Okay. So after this, so we have taken the temperature, you are going to record the temperature as well. Yeah. After that, we are going to take the pulse and the respiration together. Okay. So now, as you said, Shiny, that you will take the, you said that you are going to take the respiration for about 1 minute. But see, if respiration, out of all these things, respiration is the only thing which anyone can control. Like if I want, I can hold my breath. Yeah. And that's why I can control my breathing. Or if I am getting anxious, then I might breathe faster than what my regular or normal breathing is. So that is the reason that we check the pulse and the respiration together. But we are going to tell the patient that, okay, now for the next 2 minutes, I'm going to check your pulse. So we are not going to say that we are going to be checking your respiration. We are going to only say that for the next 2 minutes, I'm going to check your pulse. And during this time, I want you to be quiet and try not to talk, so that I can count the pulse in an undisturbed manner. Yeah. Then you are going to be checking the pulse of the patient, and you will say that, okay, I'm starting now. And then look at the clock and make sure that you complete the entire 2 minutes. So in that entire 2 minutes, for the first 1 minute, you are going to check the pulse. And then without taking your hands off from the patient's pulse, you are going to check for the next 1 minute, you are going to check for the respiratory rate. Okay. So once you have done that, then you are going to explain it to the patient that, okay, in this time, in these 2 minutes, I checked your pulse for 1 minute and I checked your respiratory rate for 1 minute. And these are your pulse and respiratory rate. I did not tell you in advance because I did not want you to be conscious about it. Because sometimes if you get anxious or conscious, it might change your respiratory rate. Okay. Everyone understood that?
Yes, ma'am.
Yes, ma'am.
Okay. So this will now, after this completes our taking all of the vitals. So you have taken the blood pressure, you have taken the temperature, you have taken the oxygen saturations, you have taken the pulse and the respiration. Okay. So that will complete our taking of the vital signs. Okay. So now if we go after this, you will need to, depending upon what is your scenario, you will then need to plot these readings, what you have taken. Okay. So if we go, the next one, my next slide is that you are going to be taking it was the news scenario that you have got. So you will need to now complete this news chart. So if you look at the news chart, so you got, say, you can, now when you are practicing at home, you can make up any of your readings and try and make up all weird kind of readings so that you get in a habit of filling all weird sort of readings and coming up with a score. Okay. So now, as we discussed yesterday, that news stand for National Early Warning Score. Now, what that indicates is the why you do the news score is that because you want to make sure that with the news, it will give you an idea that how often a patient should be observed in the ward. Like say, if the news score is 0, then you can say that all of the vital signs are within normal range. So you can actually, the regularity of observing the patient can be once every 12 hours. But if you see that the score of the patient is between 1 and 4, yeah, then that means that there is something which is abnormal. So that will make that you will need to observe that patient more often. So if the score is between 1 and 4, you will need to observe the patient every 4 to 6 hourly. Then there is that if it is possible that the patient score is more than like between 5 and 7. So if it is 5 and 7, then obviously that is going to mean that not one, but quite a few things are all going up and down. Yeah. So they are abnormal. So you will need to make sure that you are going to do the observations every hour, because patient is now more sick. All the readings are going abnormal. Yeah. And if it is more than 7, then it is obviously the patient is in the critical condition. So for that, you are going to be observing on a regular basis, continuously. Now, all this, the key to how to find out the observations, you will be given the key as well in the exam. So you don't have to memorize it by heart, or you don't have to by heart it. You will be given a key for it. Okay. But also you have to, one more thing that you have to make sure is that if at any time, if you get 3 in one single parameter, then you have to make sure that you do an hourly observation of that patient. Even though the score might just be 3, even then you will have to do an hourly observation and not 4 to 6 hourly. Now, has everyone understood this? Yeah? Okay, good. So you, as we had discussed yesterday, that you can see that it is color coded, and the white color is 0 marks, yellow is 1, orange is 2, and red is 3. And according to where your readings are going to be falling, you are going to be marking it over there. And then depending upon which color your readings have fallen, you are going to calculate the score. And you are going to write a score over here in the end. And then you will see that there is a monitoring, a block for monitoring frequency. So you are going to be putting the monitoring frequency according to your score. Yeah. And after that, there is another column which asks you escalation, that or you are going to escalate the care or not. It's asked you Y or N, or yes or no. Now, what do you understand by escalation?
We need to inform our in-charge or doctor.
So you will need, by escalation, it means that you are worried about something and you are going to be asking someone else, or you are going to inform your senior to say that, look, this is something I'm worried about and we need to do something about it. Okay. So whenever anything is abnormal, it is important that you escalate the care. Okay. So you are going to be marking over there yes or a no, depending upon what score you have got. And then in the end, you are going to do an initials. So you are going to sign it over there. Okay. So normally you will be filling this form, complete this form, say yes, no, do your initials. And after that, you can explain it to the patient that, okay, your score is so and so, and I'm going to be escalating your care because I'm slightly worried about your pulse or blood pressure or temperature, whatever. Yeah. Now, has everyone, sorry, yes?
Regarding the signature, whether we should only sign as our initials or the full name should be?
Only initials. Yeah, only initials. There will be a place in the chart in the exam where you will have to write your candidate name. So over there, you can just initial it. Okay. Now, any confusion about the news chart? Yes, Agu, tell me. Just unmute yourself. I can't hear you. Unmute. Agu, just unmute. Yes.
Confused about where you said that if we get 3, in one reading that we are going to continue observation?
No, we are going to be observing every 1 hour. If we get 3 in a single parameter.
Like if we get 3 in temperature or in blood pressure or in pulse, we are going to, okay.
Yeah. Anything in red means that you have to do every hourly observation.
Okay.
Unless there are 2 or 3 reds, which means that if the score goes above 7, and then it is a continuous observation.
Okay. Thank you.
Yeah. I have shared the key as well along with in the group. If you will see, I have already shared the key for it. So please have a look at the key. It has given the details of what you have to do when according to the score.
Okay.
Yeah.
Thank you.
Any other question anyone has? Okay, so in the chart, you will also see that there is a place where it asks whether the patient is on air or oxygen. So please make sure that you mark it over there, whether if the patient is on air, you will mark as A. And if it is oxygen, then obviously you are going to put on the oxygen. Yeah, it is if you'll see, it is the 4th column down above blood pressure. Then you will see that there is also a column in the section, which is D section, where it asks about the alert, confusion, verbalizing pain and unresponsiveness. So over there, you will need to make sure that you mark it alert or confused as well, depending upon what is your history. Understood? So please don't leave them just like that. Yeah, you have to complete that as well. So this is basically, this is the key that I was talking to you about. So if you will see, 0 is minimum 12 hourly that you are going to be doing it is continued routine monitoring. So routine monitoring is in 12 hours you are going to be doing it. If your total score comes between 1 to 4, then you are doing 4 to 6 hourly and inform the registered nurse. So you are going to tell escalate the care. Registered nurse decide whether the increase in the frequency or escalation, further escalation is required. They can then decide. Okay, then it says that if 3 in single parameter, then you have to do minimum 1 hourly and you are going to escalate the care as well. If your score is total of 5 or more, then they reach the urgent response threshold. So even then it is minimum 1 hourly that you are going to do and you are going to escalate. And if it is 7 or more, then it is like a critical condition. So it is a continuous monitoring that you are going to do. Agu, does that make it more clear? I hope it is clear to everyone. It's a simple, straightforward sort of thing. Yeah. Okay. So now I'm going to give you an example scenario. And I want one of you to take me through that. How are you going to do this one? Yeah. So who is going to do it? Who wants to do? Let me just pick someone. Jinsi, do you want to do it? So how I want is that I want you to have a look at the scenario and I want you to do the introductory 6. And I want you to take me through taking all of the observations of the patient. And then I'm going to give you a flashcard. And in that flashcard, then you are going to tell me the score of the patient. And you will then tell me how often the patient needs the observations and whether there is escalation or not. Okay?
Okay, ma'am.
Okay. Now before, just before we do that, I just want to tell you one more thing so that we can. Yeah. Jinsi, hold on a minute. You are audible, but just hold on a minute. Before we go ahead, I'm also going to show you one more screen so that we are able to complete the scenario. Yeah, so let me just go to that one. Can you see the screen? Can everyone see the screen?
Yes, ma'am.
Yeah. So this is the screen. So this is something you will be given this paper where you can see the activities of daily living. So this paper you will be given. So this is something that once you have taken all of your recording and you have completed the news chart or GCS or must or whatever chart that you are going to do, once you have done that, then in order to complete your station, you will have to quickly ask these questions relating to these things as well. Yeah, like we had discussed yesterday, that when we are trying to make sure that we have taken a complete history of the patient, we would want to know that whether they have, otherwise they have any problem with the breathing, if they are having shortness of breath, how often do they get shortness of breath, whether otherwise normally their temperature is all right or not, are they able to move independently, are they able to go to the toilet, do their normal day-to-day sort of activities. Then is there any problem with eating or drinking? Have they been suffering with any constipation or diarrhea? Do they have any regular aches or pains anywhere else? Do they suffer with arthritis or any chronic pains and things? So you will have to ask all these things very briefly so that you are able to complete the scenario. Have you understood that? And do you have any questions in that? Jinsi?
Yes, ma'am.
Did you understand this one?
Yes, ma'am.
Yeah.
Actually,
so,
okay. Yes, ma'am.
Tell me.
Yeah,
okay.
I couldn't hear properly, sister. Ma'am, the voice is breaking.
Okay. Can you hear me now? Lakshmi, can you hear me?
Yes, ma'am. Yes, ma'am.
Okay. So then what I want is that let us divide it into 3 parts. Okay. I don't want Jinsi to feel that she is the only one who is doing everything. Okay. So Jinsi, you are going to do the introductory 6. Lakshmi, you are going to tell me as soon as Jinsi finishes the introductory 6, you are going to take over from there. And you are going to do the taking all the vitals. And Roshni, you are going to then tell me the activities of daily living and closure of the station. Everyone understood that? Okay.
Yes, ma'am.
Okay, so I'm going to bring up the scenario. So that is the scenario. So Jinsi, you can start with your introductory 6 and you can leave it till you have established the purpose of your visit. Okay, you can start now.
Okay, ma'am. Okay. It's safe for me to enter the room.
Mm-hmm. Turn on your camera.
There is no loose wire.
Mm-hmm.
Are you able to see me?
Not as yet.
Actually, I have on my camera, ma'am.
Oh, yes, I can see you now. Yes. So carry on. Yeah.
Okay. It's safe for me to enter the room. So there is no wires, there is no spilled waters. Okay. After that, before approaching the patient, I'm doing the hand hygiene. First, I'm taking the hand gel on my hand. First, palm to palm, then back of the hand, then palms interlacing, then back of my fingers, then a rotational rubbing of my thumb, then rotational lump of my rubbing of the fingertips, then wrist to forearm of my both hands.
Well done.
Yeah. Okay, I have done with my hand washing. Then I'm going to introduce myself to the patient. Okay. Hi, good morning. I am Jinsi M. Shobhan, one of the registered nurses working in this department. Okay, today I'm going to take care of you. So before going further, can I confirm your identity?
Yes. So you want to know my name and date of birth?
Okay. So could you please? Yes, please tell me your name and date of birth.
Yeah, my name is Raj Palmer and my date of birth is 20th of November 1962.
Okay. So my case notes also saying that your name is Mr. Raj Palmer and your date of birth is 20/11/1962. Okay, let me check your wrist ID band. Okay, your name is Mrs. Raj Palmer and your date of birth is 20/11/1962. Okay, I'm a right person. Okay, okay. Then I want to know about the allergies. Do you have any allergies to any medications or any plastics or any adhesives or any latex or any foods?
No, I'm not allergic to anything.
Okay, well, okay, you are not allergic to anything. I'm documenting that. Okay, so now I am here to discuss you regarding something. So I know that you are diagnosed with abdominal hernia and you are due for the surgery today. So from your face, I can see that you are a little bit worried. Okay, am I right?
Yes, I'm worried about the surgery.
Okay, see, Mr. Raj, don't worry about that. We, the expert team, are along with you. Okay, we will give you the best care as much as possible. So don't worry about that. So, do you have any fluids or anything for the last 6 hours?
No, I was told to be nil by mouth.
Perfect, Ms. Raj. Okay, so you are almost ready for the surgery. Thank you. Okay, so now I am here to carry out an assessment. Before you are going to surgery, I want to know about how we are doing, how we are physically fit for the surgery. So it will take hardly 5 to 10 minutes. So if you want to go to washroom or anything, so you can do it. After that, I can do that.
No, I'm fine.
Otherwise, if it is okay for you to do right now, can I proceed with that?
Yes, you can.
Okay, ma'am. Okay. So now I'm here. My assistant is starting right now.
So who is taking over from Jinsi? Lakshmi?
Okay, ma'am.
Yeah.
So I would like to check your temperature, pulse, and blood pressure. So let me start taking your temperature. This instrument is clean and compactable. So it's actually, I have to check with your ears. So I would like to know that you're using any kind of hearing aids or you have any pain in your ears, so that you can tell me about that. Do you have any problem like that?
No, I don't have any problem.
Okay, let me check your temperature. Okay, it's in the normal limit, and now the temperature is 36.9. Okay, then let me tell you that now I want to do your blood pressure. So it will do it. I have to do it in your upper arm. So is it okay for you? Do you have? I can see that no fluids are going on, and there is no. Do you had any past surgery, or do you have any problem with your arm?
No.
I can't see any redness or any other problem. So is it okay for you to do that?
Yeah, that's fine.
Okay, let me tell you that when we will do the blood pressure check, I have to cover the 80% of your arm. It will be about 2 to 3 centimeter from the cubital area. And once I started to inflate, it may squeeze your arms. So nothing to worry about that. If you have any pain, you can inform me. I can release that pressure. So it won't last for, it will be a couple of minutes. It will finish. So is it okay?
Yeah, that's fine.
Okay. So let me take.
Okay.
Okay, ma'am, it was just disconnected.
That's
Sorry.
no Carry
Continue. Okay, the BP is the blood pressure is on the normal limits. It's 130/80.
Okay.
And now let me check your pulse. It will last for 2 minutes. And let me do that. Okay. Okay, now I've done your pulse as well as your respiratory rate for 2 minutes. The first minute I check your respiration and it is 24 beats per minute, and your pulse rate is 74, and everything is in the normal limit. So that was your, everything is all normal. So do I have to calculate the new score, ma'am?
No, we'll come to the new score. But you have missed one thing. What has she missed?
Saturation.
Oh, I forgot to do the pulse oximeter. I didn't check the oxygen saturation.
Okay.
Sorry, ma'am. I won't.
It's okay.
I won't.
Now
Okay. Sorry, I missed out to check the oxygen saturation.
So you can tell me now.
I can see your nails are clear and your capillary refilling time is perfect. So as you are not wearing any kind of nail varnish, so I can check your oxygen saturation. That is also in the normal limit. And oxygen saturation is 95. And every parameter is in the normal limit. And
okay. So what you have said is that your oxygen, now let us bring up the news chart and try and calculate the new score. So you said that the oxygen, first of all, you said about the respiration. You said it was 24. Now just see, where does the respiration fall when you say 24? Okay, can you see it now? So where is it falling?
Yellow. No. Orange.
It's in yellow.
Is it yellow or is it orange?
Orange.
Orange.
Scoring 2.
Yeah, so it is not normal then.
Not normal, yeah.
Yeah. So what that tells us is that we should not jump on to say normal or not normal. You can just say that, okay, your respiration is 24. That's it. Yeah. At that time, you don't need to tell the patient whether it is normal or not. Okay, so you will give a score of 2 over here. So you are going to mark it over there. Then is the patient, what is the patient oxygen saturations?
That's 95.
95. So where is 95?
It's in yellow. 1.
It's not in yellow. It's in 95
yellow.
to 96 is orange. 93 to 94 is yellow. And 95, just hold on a minute.
94 to 95.
Yeah, no. Yeah, 94 to 95
94 to 95 is yellow.
Yes, you're right. 94 to 95 is yellow. So it comes into yellow. Then that is also not normal. Yeah. So you will give a score of 1 over there.
I'm sorry.
Yeah, no, nothing to be sorry. This is the first time you are doing it. So that's not a problem. Yeah. So then we come to that patient is on air. Patient is not on oxygen. So that is fine. Then you are going to be coming to the blood pressure. Now, what was the blood pressure?
130/80.
So 130/80. So where is 130? Where are you going to mark it? In which column?
It's on the white, 121 to 140.
Yes.
121 to 140.
Yes, that is correct. So in blood pressure, we because obviously there are two readings. Now one reading is always going to fall between red, yellow, or orange. So we, for the calculation of the new score, we take only the systolic reading as what we are going to be counting. So now systolic over here, it is falling in white. So that means that it is 0. Did you understand that? So if the blood pressure have been 110 by 80, then you would have given a score of 1 because 110 is falling in yellow.
Okay.
Yeah, but now 130 is falling in white. So we are going to give a 0 score for this one. Okay.
Ma'am.
Yeah.
Okay, so we don't have to record the diastolic pressure anywhere in this chart?
No, you will need to record the diastolic pressure, but you are only going to take the systolic pressure as for the reading. Now, when you record the blood pressure, what you are going to do is like you are going to mark a dot in 121 to 40 column, in that column, because your blood pressure is 130. And then you are going to mark another dot in 81 to 90 column because the blood pressure was the diastolic was 84, and you are going to draw a dotted line to like you do for the blood pressure. Yeah, okay. So you are going to mark it, but for the calculation's sake, you are only going to take the systolic blood pressure. Yeah, okay. Because okay. you'll see, otherwise it is always going to, the lower are always going to fall in red or something, because that is the normal. So you can't calculate or you can't take that as for scoring. For scoring, you are only going to take the systolic.
Okay, ma'am. Thanks.
Okay. Okay. So we are saying that the score is 0 over here. Then the pulse. What was the pulse? You did not mention the pulse. So what pulse do you want to say?
Yeah, pulse was 74 beats per minute.
So pulse is 74. Then that also is falling into white. So 0 for that one as well. Patient is alert. And I think your blood, the temperature you said was also normal, 36 point something you said.
36.9.
Yeah, so that is also falling in white.
36.9 I told.
Yeah. So what becomes your total score then?
The total score is 3. 3, ma'am.
Okay, so what does that mean then? Now total score you have written as 3.
Every 4 to 6 hourly.
Every 4 to 6 hourly. So that becomes your monitoring frequency. And whether you are you going to escalate the care?
I don't think.
Why don't you think so? Look over here. You have got 2 readings which are abnormal.
Yeah.
So don't you think that you should escalate the care?
I need to.
Yeah?
Yes, ma'am. I need to escalate the care.
So
yes,
if your score is between 1 to 4, you are doing 4 to 6 hourly, and you are going to inform the registered nurse. Yeah, so you are going to escalate the care as well.
I need to
escalate. You need to write
okay, ma'am.
Y over there. Yes.
Escalate the care. Okay, yes, ma'am.
Okay. And then you are going to initial it.
Okay. Okay.
Okay. So well done for that. Now in this one, the only thing I want to tell you, Lakshmi, is that we need to explain a little bit more. You can't just say that, okay, I have checked your oxygen saturation or your capillary refill and it is fine. See, when you say it is fine, I know that probably you know it. But as an examiner, how do I know that whether you know that how to check a capillary refill or not? If you are saying it is just fine, it doesn't mean anything to me as an examiner. So as an examiner, whatever is going in your head, I need to know that. And that is the reason that why you have to verbalize it, that why you think it is normal. So then you will need to say that, okay, I have pressed it for 5 seconds. It has come back in, I can see the color has come back in under 2 seconds. So your capillary refill is normal. Yeah. So you actually have to say all these things. Okay. Same way, when you said about the temperature,
Sure.
you can't just say that, okay, I've checked your ear is looking all right and I've taken your temperature. No, you will have to explain each and every step that, okay, I have make sure that I'm putting a new probe, which is clean, and you are going to hear a beep sound. And when I'm going to put in your ear, so I can hear that the beep sound is there, I can take the temperature, and now I'm going to discard this probe. So each action, you will have to say it.
Okay.
So you will need to verbalize. So get in a habit or practice of verbalizing this thing. I know sometimes it sounds and you feel yourself, you feel so stupid saying even the small things, but this is how the exam is. This is how you need to tell. The examiner can't get whatever is in your head unless you tell them. Yeah.
Okay, sure, ma'am. I'll do that.
Yeah, but otherwise,
I'll make sure.
Yeah. So who is concluding the scenario?
Thank you.
Who was doing the?
Me, ma'am, Roshni.
Okay, Roshni. Yeah. So now your score has come. The score is 3. So you have to now explain the score to the patient. Take the brief history with activities of daily living, and then you are going to conclude this the station.
Ma'am, can you please show that chart which you are seeing?
I'll show it. Can you see it?
Yes. Well, Mr. Raj, I have just done your assessment. In that, your new score was 3. But if you could you please tell me something more regarding your pain scale, as you have complaints of abdominal pain? Still, it's persistent?
I am the pain is still persistent, but I'm very worried about the score of 3. What do you mean by this? What is this?
Well,
score?
it is a yeah, this is a national scoring system which is usually be used here for the clients. Based on that, we will plan your care accordingly. As your score is 3, we have to inform your respective physician, and we will plan the care as per the physician's advice. Okay, nothing to worry about that.
Okay. Yeah.
Nothing. Actually, if anything is there, I will just inform you. It is just for the informational purpose I informed you regarding this.
Okay.
First of all, I will inform this to the doctor, and if he is advising something, I will definitely explain you.
Okay. Okay. Thank you.
Is that okay?
Yeah, that's fine. Thank you.
Yeah. And are you able to do your movements and all? Are you able to move your hands, legs, and everything?
Yeah, that's fine. I don't have any problem with them.
Yeah, and your vital signs is absolutely okay, except this respiration and your SpO2 saturation. Other than that, everything is fine. Have you passed your stools in the morning?
Yes, I have.
Yeah, that's good. So how about your eating and drinking? As I know you are on a nil by mouth. Have you taken anything prior?
Not today, but before that I was eating all right. So
Yeah,
I did not have any problem with eating or drinking before that.
That's perfect. So I have collected all your data. I think you are now ready for the surgery. I can prepare you for the surgery as well.
Okay.
So that's all about the assessment part. I have done with my assessment.
Okay, that's good. So kind of slightly got stuck with how to conclude the station, what to say, how to end. Yeah. So now this is something that, see, it is as important as your entry, that how you exit as well. Now the exit is also almost the same in each and every of the stations. Yeah. So in each and every of the station, exit is also the same. So how we do is it that we are going to say that, okay, Raj, I have done your assessment. And as you explained that as I said that your score is 3. So your respiratory rate and your oxygen saturation is a little bit abnormal, but nothing to get concerned about. I will be discussing the findings with the my senior and the physician, and accordingly we are going to plan your care we will be monitoring you every 4 to 6 hours to make sure that the readings are not getting any worse. And also, if there is any other problem, then we are here to help you out. So I will be leaving a call bell with you. So if there is any concerns that you have in the meantime, you can always ring and call us, and someone will come and assist you. So I will be now taking all of my articles back, make sure that I clean them and make them ready for the next use. I will also update your record with all the findings, what we have done. And I'll make sure that they are all updated and the doctor is aware of that one. Now, before I leave, will be opening up the curtains and things. I'll make sure that you are as comfortable as possible. Is there anything else that I can do before I leave? So you give an option to the patient, or do you have any queries or any questions that you would like to ask before I leave? If the patient says that, no, I'm fine, then you can say that, okay, I can see that you are looking quite comfortable. And I'm going to make sure that you are ready for the surgery. And as I said, the call bell is over there. So please let us know if you require any help. Okay, thank you very much. And then you leave. And before leaving, you do your final hand hygiene as well. Okay, so now that is also there for each and every station. You are going to have the same sort of closure that you are going to do. You will very quickly, you are going to summarize what you have done. And then you are going to be saying that, okay, now I'm going to be leaving this call bell. I'm going to do a recording all of your things in your documents or update your documents. I'm going to make sure I take all of my articles, clean and calibrate them and make them ready for the next use. I'm going to draw back the curtains, make you comfortable. Over here, patient was nil by mouth. That is why we did not offer him something to eat and drink. Otherwise, you can always say that, okay, before I leave, can I get you a cup of tea or some water or something? You can say that. And then you will say that, okay, I'll do my final hand hygiene and I'll leave. Okay. So now today we have gone through the whole one sort of assessment. We have done the news chart and we have gone through like all of the steps, entry, how do we take the vital signs and the exit. Okay. Now I'm quickly going to tell you a little bit about the GCS. Now the GCS, as we had discussed earlier, if we see in the GCS, you are going to do all of the things which you have already done in the news chart. You are going to do all of that. So you are going to take the blood pressure, temperature, pulse, oxygen saturations. You are going to take all those things. But along with that, you are going to do a small neurological observations as well. Yeah. So I do not need to tell you again about how to take temperature, blood pressure, and all those things. You are going to do exactly the same way as you have done in the news. But you will tell the patient that, okay, Mr. So-and-so, or let's say, for example, Raj, okay, Raj, I see that you were admitted because of the head injury. Now I'm going to be taking some observations, which will include taking your temperature, blood pressure, pulse, and all that. But along with that, I'm also going to be doing a small assessment of your, the neurological assessment as well, just to make sure that your head injury has not affected anything major. Yeah. And then you say that, okay, I can see that you are talking to me. Your eyes are open, because if you will see, the first thing when you are going to calculate the GCS, the first thing is your eye opening, whether the eye opening are spontaneous or whether they are to speech, to pain, or none. I'm sure that all of you would have at some point in your career would have calculated the GCS. Yeah. So the first thing is that you are going to making sure that you'll comment on that. I can see that your eyes are opening spontaneously. Now, can I just check that, do you know where you are? So you want to check whether the patient is oriented or confused. Okay. So you say, ask the patient that, do you know where you are? And if the patient says that, oh, I think I'm in a supermarket, then you know that the patient is confused. Yeah. So you can say that, okay, you are actually in a hospital. So, but never mind, that is no problem. And then you move on. Yeah. So in the exam, you are not going to get anything below confusion. So your GCS is not going to go below 14. Okay. Because they want you to actually just do all your recordings and everything as well. So, but there can be, a patient can be confused. So then your next thing is that, okay, Raj, can you just lift up your arm? I just want to see that whether you are able to do that, because you want to check that whether the patient is obeying your command or not. Yeah. So the patient will lift up the arm, and then he lifts up the arm. You can also check with the patient that, is it hurting? Are you having any pain in that? And the patient will say that, no, I'm not having any pain. Then you can say that, is it okay if I use that arm for blood pressure? So very smoothly from GCS, you can go to the blood pressure. Yeah. Patient will say that, no, I'm not having any pain, and you can use this arm. Then you can just carry on saying that, okay, I want to also check if there is any cannula or any bruising or any other symptoms on that one, like you would check for the blood pressure. So then you will do your blood pressure, temperature, pulse, and respiratory rate. You are going to check all those things. Yeah. And then there is also the thing that you will need to check the patient's pupils, and you will need to check the strength in patient's arm, upper limbs and the lower limbs. Now, when you check the pupils, you know that you will need to shine a torch in the patient's eyes. Yeah. So when you are going to shine the torch in the patient's eyes, what do you need to tell the patient before that?
Make sure that they are not wearing any contact lens, whether they have any eye irritation or any surgeries done before.
Yeah. And you are going to warn the patient as well that it is going to, I'm going to shine a bright light in your eyes, and it is going to be a bit uncomfortable. Yeah, but it is only for a split second. Okay. So you are going to check all these things, and you are going to warn the patient, and then you are going to check both of the pupils. So you put a hand in between, yeah, so that the light from this side does not travel on that side and make that go react to the light. Okay. So if you will put a hand in between, and you are going to check the left and the right. So when we are doing the pupil, what are we actually checking for? Angel, do you want to tell me? Or Vinoj, you tell me, what are we checking when we are checking the pupil?
Actually, at that time, we are going to check the reaction of the pupil, whether it is reacting to the light.
Yes.
Okay.
So normally, what
that.
should be a normal thing?
Yeah. It should dilate.
With the light, it will constrict. Yeah, because when there is no light, then it dilates. Yeah. So you want to check that with the light, the pupil is becoming smaller, or it is reacting to the light. So we are checking two things in this one. One, we are checking the size of the pupil, and the second thing is the reaction of the pupil. So the size of the normal pupil is usually 3 or 4. Yeah. So we'll see that we can mention that it is 3, the size of the pupils, or 4. And it is for a reaction, we are going to write a plus sign. So if you see the chart, it says that for reaction, you will write a plus sign. No reaction is minus. And if the eyes are closed, then it is C. So sometime you can see that because of the injury to the face or something, that it is so swollen up that the eyes are closed. So in that case, you cannot check the pupil. So in that case, you are going to write C. So in this one, against the pupil, you will see, against the size, you will write 3. And against the reaction, you are going to write a plus. And you are going to do for both right and left. Yeah. After that, you are going to be checking the power in the upper limbs and the lower limbs. Now for power, what do you do? How do you check the power? Yeah.
We need to apply pressure.
Yeah, so you need to ask the patient that, okay, put your hands forward, and I'm going to press them down. Make sure that you resist it. So you apply pressure down and patient will try and resist it. So if the patient's normal power, they should be able to resist you. Yeah. Same thing you do with the legs. Ask the patient to lift up the legs and you try and press them. Yeah. So that you are able to check the power. Now for the power, as you can see in the chart, there is arms and legs they have given. And then they have written normal power, mild weakness, severe weakness, spastic flexion, extension, and no response. So how you fill it is that if say I'm saying that arms, both right and left, there is a normal power. Yeah, then I can write an R and L in that sort of column against normal power. Did you understand that? So R is for right, L is for left. And if I'm saying the both right and left arm are having normal power, then in that small sort of section, I can write R and L both together. If it is that if I say that on the right side, it is normal power and left side is weakness, mild weakness, then against the normal power, I write R, and against mild weakness, I write L. Has everyone understood that?
Yes, ma'am.
Yeah?
Yes, ma'am.
Same thing we are going to do with the legs as well. Okay. Now it might seem as if that you are doing a lot in this one, that GCS you have to do a lot more than what you are doing in news, but actually it is not a lot at all. Yeah, because GCS actually you can just do in less than in 15-20 seconds you can do GCS. You can say that, yeah, I can see that you are opening your eyes. Do you know where you are? And then can you lift up your arm? 3 things and you are able to do the GCS. Okay. After that, pupil is not something you just have to put that, shine the torch, and it is fine. The power, you just ask them to lift up their arms, press down, legs, press down, it is done. So in less than a minute, you will be able to do all these things as well. And 15 minutes is a long time. You will be getting enough time to complete your stations and not run out of the time. So don't worry that it is, or don't make this notion that this is difficult and that is not difficult. Okay. So do you have any questions with the GCS? All good for everyone? Yeah. Okay.
Yes, ma'am.
Fine then. So today, I think that let us stop over here. Must and news, I think that we will try and catch up tomorrow. Yeah, because care plan, hopefully it won't take that long. So we can catch must and the PHQ9 tomorrow. But these were, I think that today we have covered quite a lot, that you know now how to take the vital signs and how to enter, how to exit, and how to take the vital signs. You also know how to complete the news chart. Okay. Now I will try and see if I can share some scenarios or some flashcards on the group, and please you will need to just fill up those things. And tomorrow I'm going to be asking that what news score did you get against them? Yeah. Don't put your answers on the group. We are going to check individually that whether you were able to fill up those answers correctly, and that whether you are getting the correct score. Okay. So in the meantime, I would want all of you today to practice again your introductory 6 and saying how you are going to take the blood pressure, pulse, respiratory rate, and all this. So get in a habit of saying those things, because it is important that it comes easily to you. You are not trying to remember everything. Okay. That will come only with practice. So you practice those things and you practice the exit, that how you are going to do the closing ceremony of this thing. Yeah. Okay. So well done, guys. Any questions that you have? How is the portal coming on? Do you have any queries regarding the portal? Is everyone able to do it easily?
Yes, ma'am.
Yes, ma'am.
Okay. So I'm really super impressed with your first attempts. I think that all of you really took yesterday's presentation and did practice, and I'm very impressed with all the people who showed me the introductory 6. So well done for that. And I can already see that by the end of our sessions, you will be absolutely ready to come and do the face-to-face training. Now, the people who are going to come in the next batch, you will also need to make sure that you continue doing it. Okay, so just don't think that, okay, we are not doing face-to-face training now, so we'll stop it. Okay, so you are the one who is getting the more advantage, that you will be having all these sessions twice. Okay, so if there is no further questions, then shall I say goodbye then? So tomorrow is Sunday, so we are not going to have a session tomorrow. So now I'll see you guys on Monday. Yeah, but I will be posting a few things on the group. Please go through them. Today, I'm also going to put a list of medication on that. Yeah, so please try and start reading the medication. From next class onwards, we will have, towards the end, we can have a quiz kind of thing of the medication so that you start remembering the medicines. Okay?
Okay, ma'am.
Okay, ma'am. Thank you.
Okay, then enjoy your weekend, guys. Have fun.
Thank you.
Okay, bye-bye then.
Thank you, ma'am.
Bye-bye.